Good morning, and thank you very much for joining us. I am Iyori Folani. Let's touch base today with the health sector. There have been quite a number of movements in there, developments, initiatives, and because it's a hardcore, shall we say, professional sector, not very many people know about it, apart from those that are really within it. So we'll focus today on the primary health development and counterpart funding in Nigeria. Our guest is Dr. Oritseweyimi Ogbe. He's Secretary of the Ministerial Oversight Committee of the Basic Healthcare Provision Fund. That's in the Ministry of Health and Social Welfare. Basically, the watchdog to the fund. Good morning, Dr. Ogbe.
Yeah, good morning to you, Folani, and good morning, Nigerians.
Okay, then. So, as I was saying in there, I am aware from the news that there have been so many developments and in there, but maybe today we sort of try and find about it, at least in an elementary way, what this consists of. Maybe we should start with the Basic Healthcare Provision Fund, which is abbreviated to BHCPF, something of an acronym, but the Basic Healthcare Provision Fund in the Ministry of Health and Social Welfare. Please explain, Doctor, what's that all about?
Thank you so much for this. I think it is critical and important that Nigerians are informed about what the Basic Healthcare Provision Fund, which we call the BHCPF, is. So the fund, it's one of the unique investments in health by the federal government of Nigeria, because it is backed by law, the National Health Act, Section 11, which establishes the Basic Healthcare Provision Fund. And it's a fund that comes out from the federal government consolidated revenue, at least 1% of it, and it's a fund that is targeted at improving access to health for Nigerians, particularly at the primary healthcare level. And so we consider it a very catalytic fund. That's a fund that is supposed to jumpstart things to happen, and it has done that over the years. So the way the fund is structured is that every year, the federal government, through the actions of the National Assembly, allocates at least 1% of the consolidated federal revenue to the Basic Healthcare Provision Fund. So the fund is released to the Federal Ministry of Health, and in line with the guideline, the fund now goes, and the law, the fund now goes through the National Health Insurance Authority to actually ensure that Nigerians are insured and can receive health care without pain and without financial hardship at the point of care. So this is this money, which constitutes about 48.75% of the fund, is channeled through the National Health Insurance Authority to the state health insurance authorities, and from there, Nigerians are enrolled by the state health insurance authorities, and then money is paid to primary healthcare centers, which are mainly the basic healthcare provision for centers, as capitation, so that when people are ill and they go there, they don't have to pay. And when they are referred for secondary care, or when they have emergency cesarean sessions, they're going to go to the secondary hospitals. They don't have to pay. They are insured, and this will be covered by the state health insurance under guidance from the national. Similarly, 45% of the fund goes through the National Primary Healthcare Development Agency that now sends this money to the states equally through the state primary healthcare boards, where part of this money, about 10%, so there's 45%, you split that into 10 and 35. So 10 is used by the state primary healthcare boards to hire midwives particularly, and other community health workers who will now help to see that there's quality care in the facilities, while the community health workers engage with the community at their homes and in the community, and also guide them to the facilities as required, right? And these funds now, when they get to the state primary care board, minus for the health workers, the 35%, like I said, is sent directly to primary healthcare centers across the country, so that they can have money for their operations and able to provide quality services. So this primary healthcare center receive the money for operations. Operations are things to ensure that the center is open, they can fuel their generator if they have one, they can conduct outreaches, they can buy basic commodities to tidy up the center, And with the money they get from capitation from the state insurance agencies, they can buy medicines and commodities to provide quality care and do all those things that they need to do on a daily basis to provide quality care to Nigerians. So currently, there are 8,309 of these centers spread all across the country, across the political wards. And right now, and we can get to that later, there is going to be expansion of these centers because of increased funding. That is thanks to the leadership of Mr. President himself and the National Assembly, and to an additional 5,212 of these centers. So by the close of the year, as we enter into next year, we should have about 13,521 or thereabout of the basic care provision centers that are providing services to Nigerians across the country. So that's in a nutshell. There are also two other parts. Gateway that also receive money.
One moment, please.
Yes, please.
Do I get that the health sector is having a joint annual review of this process, such as you have described?
Yes, right now, starting yesterday, under the leadership of the Honorable Coordinating Minister of Health, Professor Mohammed Ali Pate, the Minister of State for Health, the Permanent Secretary, and the leadership of the health sector, the CEOs of the agencies under the health sector, our partners, CSOs, and of course the media. On an annual basis, the health sector has a review of its performance. And this, for this year, started on Wednesday and to be concluding today in Abuja. And what happens at what we call the JAR, the Joint Annual Review, is that you look at the performance and transparently declare how well we have performed, identify the challenges, and collectively take decisions on how we are going to improve and make sure that Nigerians get better healthcare in the coming year. And this is done every year. It was done last year, it was done this year, and will be done next year. And one of the core things that was unique in this is that the Honorable Coordinating Minister, in line with Mr. President's agenda, insisted that we must discuss about corruption in the health sector and the actions that are being taken, particularly as it regards the Basic Care Provision Fund, of how we are trying to contain that and make sure that for every naira spent, Nigerians get more health for it.
At least this part of it, sort of figures in with my notion that the BHCPF, as we had explained before, under the Federal Ministry of Health, is like a high-level oversight committee to see that everything is going the way it should be going. And I'm happy you spoke about that that word corruption, because unfortunately people feel that when a thing of this scale is going on and this expense, there will be so many cracks through which things can fall. And I know that is why we have an organization such as we are talking about here to sort of, just be the watchdog. How big a task is that?
Okay, yeah. So with the assumption of the Honorable Coordinating Minister of Health in office after being appointed by Mr. President, I think it will be important to really look at globally how the Ministerial Oversight Committee evolved.
Okay.
So Mr. President, providing leadership, identified key areas of the health sector which we call the presidential commitment that must improve. And one of them was really things to improve primary healthcare center across the country. And so what the Honorable Coordinating Minister did was now to reform the existing Ministerial Oversight Committee and expand it such that it looks over and provides oversight over every major priority program that is being implemented either by government of Nigeria or funded by our development partners across the country, inclusive of what we call our SWAP Coordination Office and the Basic Healthcare Provision Fund. And the main reason for this was that most times many programs are ongoing continuously and simultaneously, and there's often a tendency to operate in silos, so there's chances for duplication, and people do not know what the next people are doing, and so you could be duplicating efforts and reducing the efficiency of your resources. So with the expanded Ministerial Oversight Committee, which is chaired by the Honorable Coordinating Minister, and have seated the directors of the Ministry of Health, with co-chairs as the Minister of State and the Permanent Secretary and Chief Executive of the various agencies responsible particularly for the Basic Care Provision Fund. Everybody is able to provide on a quarterly basis their progress reports, their challenges, and their accounts. And so everybody knows what everybody is doing, what everybody is spending. The committee approves what monies should be disbursed to who after they have been satisfied that the necessary preconditions have been met. And so that way, there's been significant reduction in duplications. There's been more coordination and coherence in how we work in the health sector. And this is really because we have adopted what we call a sector-wide approach swap, where everybody is focused on one plan and everybody's implementing that same plan based on national priorities. And we are speaking with one voice and having one conversation about what should be done. So nobody is now working in silos. Everybody knows what everybody's doing. And as such, we are now expanding and getting more value for every naira that is committed to the invested in the health sector. And all these are part of the bigger national health renewal, renewal strategy investment initiative, of which the BACPF is the anchor, because that is one fund that is backed by law and guaranteed to be sustainable coming year in, year out by every government that comes.
How well is this? Sorry, I was going to ask how well you would say this aspect of the oversight is working. It's because you did start from the beginning saying that, look, this is not an entirely new program. It might be that the way we are now interrogating it, revamping it, you know, for better effectiveness and all of that. So how well is it working? Is it meeting the expectations of the Honorable Minister of, the Coordinating Minister of Health?
Yes, thank you very much for this question. So one of the first things that happened as soon as the new government assumed office under the guidance of the President, Bola Ahmed Tinubu, the Honorable Coordinating Minister took a stock to say the core of the strategy for the health sector is the BACPF. And so he took a stock of how has it fared in terms of program delivery and also fiduciary. And in terms of program delivery, I think there was evidence to show that the fund has been making a difference in Nigeria, but a bit suboptimally because the indicators and the kind of outcomes that we should be seeing were not as good as they could have been if it has been more effective. And so at the fiduciary side, there were gaps, which was noted by the Office of the Accountant General of the Federation. He had meetings with all the state commissioners, even engaged the governors, and now put in place steps that must happen to see that before, as we move forward with the fund, things are more transparent and more accountable. Then he now mandated all implementers of the gateway, the CORF, which is the National Primary Health Care Development Agency, led by Dr. Muyaino, and the National Health Insurance Authority, led by Dr. Kelechi Ohiwi, to come up with reforms that will actually transform how the Basic Healthcare Provision Fund is implemented. This took a while, but honestly, it was worth it. So they've now so reforms have now been done. A new guideline, which we call BACPF 2.0, has been released. This was unveiled by the minister a month back, but took effect from June this year. It has been released, and based on that reform, there are now better accountability measures in place to see that the funds are better used, we get value for money, is accountable, and is transparent. And already these mechanisms are already beginning to see the results of the mechanisms. And we think as we continue to implement it into next year, we'll begin to see really, really big differences about how the fund is impacting on Nigerians. So I could spend some time and just go over some of these mechanisms that have now been put in place under the revised BACPF guideline to see to it that Nigerians have a better value for money under the BACPF. So like I said, the first thing that was really done by the Honorable Coordinating Minister was to improve the overall oversight at a national level by expanding the MOC, because one of the things we observed from field reports and also surveys that were done and by both government and also by CSOs and even the independent researchers was a lot of duplication across the system. So by expanding the Ministerial Oversight Committee and bringing everybody to sit on the table in one conversation, we're able to see who is paying for what and what they have been using their investments for, and as such to be sure that people are not investing in the same thing and eliminating duplication. Because why it might be with the best intent nationally, but as you go down the chain, then there's chances of people double reporting for the same amount spent. So with the oversight committee, those duplications are literally being eliminated, as everybody knows who is paying for what and what they are doing with their funds. The second thing, there was that improving fiduciary controls. So this was being done by various actions, quite a number of actions, but key amongst them was first, under the National Primary Healthcare Development Agency, the NPHCDA, what we call performance and financial management officers were recruited competitively across the nation and deployed to all 774 local governments in Nigeria. They're right now on ground. They visit the basic care provision fund facilities. They check to see that they have received their money. They check to see what the money is being done with. They check to see that there's evidence on ground to show what the money is being done with. They verify the reports that they give in terms of how many clients that are coming to see, revitalization that is going on in the facility, and where they see suspicious activities, they report it to the national, but also engage the states to report it and also propose necessary steps that should be taken, and this is going on actively. Supporting them are the health fellows, which a program that was launched by Mr. President himself. They are also in the local governments, all 775 across the country, but they are more looking at the holistic system and identifying gaps in the system and using their initiative to come up with solutions to that gap, working with states. So this is just like smart Nigerians being asked, what do you think we can do different? And there have been good reports of them actually engaging with the local governments and states and making a difference. Then, but more critically, because of the span of control of 8,000 facilities across all LGs in the country, there was an urgent need to digitalize. So under the MPHCDA, a primary healthcare financial management system application has been developed, and this has now been rolled out in in 6 states so far across the country, and is going to be scaled up across all states in the coming months. And the idea of this is that for those facilities that receive the Basic Care Provision Fund, they can now electronically enter their plans. This was being done manually before and needs to go to the state for approval. So you can imagine the bottlenecks where a state has to look at 300, 400 plans for their facilities to approve it. But electronically now, these are now being entered and being reviewed by the states electronically. And every expenditure they make is entered electronically. And once they have entered their expenditures, every quarter, automatically, their reports of expenditures are generated, and this can be viewed at all levels across the country by authorized persons, and to see the patterns and to see what their issues are. And then there are the PFMOs on ground who can now be contacted, and we also provide their independent reports to confirm and verify what reports the health workers are giving across board in the country. So this is really digitalization. Without it, there's no way you can control that span. So this is now happening, and by next year, when literally all states will be digitalized, we expect to see more accountability and visibility in how the Basic Care Provision Fund is used across the country. In addition to this, what has also been done quickly, just 2 other things that have been done, is actually to now improve establish what we call continuous auditing. So prior to now, we wait for the end of the year for the Office of the Accountant General of the Federation, Auditor General of the Federation, to go around the country and audit the BACPF. But now there's a mechanism for continuous auditing where once things are flagged, a small team engages the state, uses a checklist to do some checks, and if the checklist fails, then they do a proper audit, not waiting for the annual audit, so that we catch things on the board. And most importantly, the Honorable Coordinating Minister has signed an MOU with the chairman of the ICPC to track the BACPF. So before the close of this year, they will start their first round of tracking of the BACPF, because this was part of the renewed guideline on that 2.0. And the purpose of this is initially to create deterrence, because people know ICPC is coming to track, they actually show up to track. We expect that will create a lot of deterrence, but where the deterrence fails, then they are at liberty to take actions and to investigate and persecute as the need might be. The other things are actually digitalization and using the right data for what we do. And this is very important for the insurance. So from January next year, everybody that the National Health Insurance Agency and the State Health Insurance Agencies announced to Nigerians have been insured, particularly under the Basic Care Provision Fund. You can be guaranteed that that person is insured, because the insured person will be linked to their national identity number, the NIN. So not only are we trying to improve the use of accurate data for health to ensure that there's value for money, but also driving a larger national program by ensuring that many Nigerians actually go out to get their NIN so that they can be liable for very important services. Now, this was important because there were reports of incidences of duplications of names, or what we might even call ghost MOEs, but this is all being cleaned up right now under the BACPF 2.0. And the states are very enthusiastic about it. They are providing full cooperation with the national, and this is all going on. At the JAR, this was even well discussed and really well received that this is all going to be happening. They've been given to December to make sure that all the MOEs have their NIN. The NIMC has been engaged by the Dr. Kelechi Oyiri at the national level, and they're providing full support to see that this happens. And then this is all then also just to ensure integration of all these digital platforms. The health sector has a digital initiative, which is being led by both the Honorable Coordinating Minister and the Honorable Minister of State, working with the relevant ministries for information and technology to see that we digitize health and make sure it improves our transparency. And then lastly, we're working with the CSOs and media to improve accountability. So there's a robust accountability framework in the BACPF 2.0 guideline, and the CSOs will be leading in implementation of that framework to see that they can periodically go around, check what is happening, and release a report that we are going to sort of team as an accountability index for the BACPF. And they will be doing this starting at the start of next year as the 2.0 takes off, and then they go around to see how well the implementation is going on across the country. So these are just some of the very critical steps, and importantly, it's also publicity. So we've always done this, but it has been really quiet. For every release that is made of the BACPF, there's publication in the newspapers. The last complete release that was done in August has been published in the newspaper, and this month there'll be further releases as announced by the Honorable Coordinating Minister earlier, which has been in process and will be moving out any moment from now then, and this will also be published. But now we're going into more detail by actually identifying for Nigerians websites where they can go to actually see the facilities benefiting. So even right now, if a Nigerian googles pac.mpacda.gov, you will see a database of all primary healthcare centers in Nigeria that have been identified, over 26,000 of them documented. There are a bit more, maybe new ones and others that are not fully functional, but these have been identified and documented. And there you can also see the BACPFs. You can scroll down to see their geo coordinates, the facilities, see some pictures in some instance, see those that are being revitalized. You can see the list there. For some of them, update pictures have already been uploaded. And you can even see the phone numbers of the OIC if they have not been transferred. And you can even make calls, and there's a feedback platform on that place where you can talk about your health center, provide us feedback, and help us to do the work better alongside the states, and even more recently with the local governments coming fully on board through their Argon, which has been actually discussing with states and national to see that they fulfill their role as the true custodians of primary health care, to see that Nigerians have better health care.
Thank you very much, Dr. Ogbe. All of this seems, it clearly is a very ambitious project that the Coordinating Minister of Health has brought to bear. What is the budget that Nigeria is working with on this whole primary health development project?
Okay. I think for the Basic Health Provision Fund, based on releases so far this 2025, I think the working budget for the year has been about 131 billion, thereabout, if I'm correct. Yes, that's what it is. And so far this year, 35.8 billion has been successfully released. And this, like I said, goes through the national, through the states, to the primary healthcare centers, both to ensure and also to provide operational costs to the primary healthcare centers that are benefiting. Well, we do expect further release this year, as announced by the Honorable Coordinating Minister, of 32.9 billion. And at minimum, that should be the minimum release this year. And then with further release, likely early in January, to cover the last quarter of the year. So we expect full releases for this year to take place. And graciously, the distinguished Honorable Coordinating Minister of Finance has assured that likely next year we're going to get even a bit more money for the BACPF. And this is important because we have a target from Mr. President to ensure that 17,600 facilities by 2027 are functional around the country. And to make them functional, we need to be able to guarantee them that they have operational resources. And that's why we're now expanding to the 13,500 plus as we move forward into next year, and further expand in the coming months and years. So the expected increase is very welcome. This will increase the number of Nigerians being insured under the state health insurance and the national health insurance under the BACPF, and also increase the number of facilities that are benefiting and able to provide quality care across Nigeria.
Okay. Talk to us, Dr. Ogbe, a bit about the thing called counterpart funding as a part of all of this. Yes. How does that work, and what is its how big a part of all of this is the counterpart funding?
So the law that establishes the Basic Care Provision Fund clearly states that will benefit from the Basic Care Provision Fund, and local governments that will benefit from the Basic Care Provision Fund should provide a counterpart funding equivalent to 25% of the funds that are coming from the federal government. So the Basic Care Provision Fund is federal government. So we are subjecting it to federal government rules and financial regulations, as some states have different, might have some variance in terms of their financial regulations. So the loss is 25%. So experience-wise, when the BACPF started in 2019, when the first tranche of funds was released for it, there was a challenge about counterpart funding, because we didn't want a situation where Nigerians cannot benefit from the fund, which is backed by law, because states have not brought their counterpart. So instead, then states were encouraged to use money to sort of start off by doing the baseline assessment, training their health workers. But all that has been done. So now, under the BSPF 2.0, there is a very strong push and insisting by the Honorable Coordinating Minister, and that states need to pay their counterpart funding. So why we are going to keep on advocating and encouraging, and the minister will be talking to the governors, we will be talking to the commissioners and the technical persons, the heads of the agencies, the MPSC, the NHI will be talking to others about it. We'll continue to push hard and continue to track them, continue to name and shame those who pay or do not pay their counterpart funding. But I don't think at this time we want it to be a deterrent to Nigerians benefiting from the BACPF. But we're still working under the leadership of the Honorable Community Minister to see the best avenue to enforce this particular part of the BACPF, to see that states actually pay the counterpart. So in the past, a few states have paid, but we are now hoping as we go into 2026 that we're going to get more states responding and paying their counterpart. For they are all now aware that under 2.0 they should and must pay their counterpart, and advocacy is ongoing to His Excellencies and the states to make sure that this counterpart is paid. So it's a critical part, and it will expand the money available to cover Nigerians under insurance, and also to cover the additional facilities that need to be added to the BACPF.
Okay, because you did say a bit earlier that all of this is going to be better explained as we go along, in the public media, press, audio, video, and all of that. Because it has to become the kind of thing with the vision that you people have.
Yes.
I think you're looking for sort of a seamless delivery, healthcare delivery, especially in the public healthcare, where money, yes, which is the expense of that, has been largely, taken up, so that people don't just, as it were, quote unquote, they're not just dropping left, right, and center. That probably is the idea, but I don't know if we are close to that point yet, where anybody who has a health issue around the world, it's usually a big, tough one. But right now, with the health insurance that you were talking about, have we seen a difference in the way Nigerians are approaching health facilities, especially primary health care? As you know, most Nigerians, the way they see it is that they look for the best. People want to have a baby, they're looking for a teaching hospital. to go. People have an issue that doesn't concern, secondary healthcare, but they believe that that's where you're going to find all the professors and all the researchers. That's where I want to go. Is there a part of all of this that can be helpful in re-educating Nigerians?
Yes, excellent. I think you're really spot on. But you see, the option to go to a general hospital, a teaching hospital, because you think it's the best, is really for those in the urban settings. In most of the rural settings, the only facility close to them are the primary healthcare facilities. That's why it's so important. And why, yes, even at the JAR, it was mentioned and agreed that the level of awareness about health insurance was still quite low. But there's been a really steady upwards uptick in terms of health insurance across the country. Right now, we have 21.1 million Nigerians insured under all programs national and across the states. And of this, the BACPF is covering about 2.5 million Nigerians. You agree that's a far cry from the target of at least 80 million Nigerians that we consider to be under the poverty line. But it's improving, and the awareness is improving. And this is where we want the media, the CSOs, to actually partner with the federal ministry and the state ministries of health to actually improve awareness, not just of insurance, but also people's rights. So people are insured. Sometimes they don't know that when they're insured, they go to the facility. They are assigned facilities when they're insured. And when they go to the assigned facility, they are not sometimes aware that they should not even pay for the care because they have been insured. So that is actually improving. I think also annually and even more frequently, there is what is called the voice of the people, the community, a survey that is done. And it shows that the awareness is really improving from what it was last year. I think about 67 about that now. I think that was it's one of the things that is going to be discussed at the JAR to bring out the new figures so that people can see how that's improving. But there is a gap, knowledge gap. We do admit that.
Okay, Dr. Ogbe, I'm sorry to jump in like that, but we've got to take a break. So do please stay with us. We'll be right back. We'll continue this conversation, and the viewers can call in and ask our expert, Dr. Oritseweyimi Ogbe, who is the Secretary, Ministerial Oversight Committee of the Basic Health Provision Fund in the Federal Ministry of Health and Social Welfare. Do stay with us. We'll be right back after this break.
The Renewed Hope Initiative RHI presents the RHI Green Nigeria Challenge. Go green today for a greener tomorrow. This national competition is in 3 categories. The household category is a tree planting competition amongst 11 frontline states in northern Nigeria. Each participating household in Adamawa, Borno, Bauchi, Gombe, Jigawa, Kano, Katsina, Kebbi, Sokoto, Yobe, and Zamfara states will plant a minimum of 1 tree to qualify, with a video evidence of before and after the tree planting exercise. 20 million naira will be awarded to the best household. Submission deadline is 20th December 2026. Community category will see local governments, local communities, schools, and NGOs reclaim and transform degraded or abandoned areas such as dump sites, landfills, parks, and their likes into green, vibrant gardens, parks, and eco-friendly spaces. 50 million naira would be awarded to the overall best community group. Deadline for submission is 15th July 2026. State category will have all states of the Federation and the Federal Capital Territory, excluding Enugu State, have a chance to address the growing threats to environmental sustainability and cleanliness. States will be judged based on the number of trees planted on major roads and inner streets and how clean they are. 100 million naira will be awarded to the best performing state. Already, Enugu State has 100 million naira for being RHI's model green state due to its greenery and cleanliness. Video evidence must be submitted by participating states on or before 20th December 2026. All entries must be directed to RHI Office, State House, Abuja, or email rhi.greenchallenge@statehouse.gov.ng. RHI Green Nigeria Challenge. Go green today for a greener tomorrow.
welcome back. Our guest is Dr. Oritseweyimi Ogbe, who is the Secretary of the Ministerial Oversight Committee of the Basic Healthcare Promotion Fund. Yes, I do know it's something of a mouthful, but all of that is in the Federal Ministry of Health and Social Welfare. Something of a revolution almost in healthcare delivery, especially at the primary level. And I was just reading something here, and the coordinating Minister of Finance, I understand, has opined that the health sector stands out for its transparency and impact. It demonstrates how good governance can attract investment and deliver inclusive growth. That's Mr. Wale Edun. Any comments on that statement?
Yes, I think we were pleased to hear him opine that we're improving in terms of our transparency, because he was at the JAR himself and gave his own personal views about how the health sector was doing, and that reinforces commitment to improve and increase the amounts of funds that should be allocated to the Basic Healthcare Provision Fund. And most of these improvements actually has to do with the leadership of the Honorable Coordinating Minister, Professor Pate, in terms of his openness. Even where we're failing, even where there are gaps, we are open to discuss it, and then but immediately take proactive action to correct the gaps and move forward on a higher level and with better delivery. So and I think some of the approaches I've just talked about before the break, about the actions we are taking to improve accountability and transparency, have been key to some of this being happening, particularly the Ministerial Oversight Committee having this singular conversation using what we call the sector-wide approach, where everybody sits together, one plan, one conversation, and everybody working together in a coherent and coordinated manner to achieve and deliver results.
Now, the Basic Healthcare Provision Fund has more than doubled, we will find upon a cursory search, has more than doubled from 131 billion naira in 2024 to a projected 298 billion in 2026. Now, I wanted to ask you about a figure I'm seeing here, 150 billion being set aside for the procurement of vaccines. I wanted to ask you about that, since you don't want a shock. Nobody wants a shock to the system. And if there should be something of an epidemic, God forbid, of course it's this same structure that is going to be the safety net for it. What do you think that 150 billion for the procurement of vaccines is adequate? Still, in terms of insurance, ensuring our, the lie of the ground. God forbid that anything should happen like some pandemics that we've had. We don't have those ones now. But are you satisfied that that figure is enough, 150 billion for procurement of vaccines? And vaccines, of course, will be all sorts. We had COVID. That was the big one. But what are things out there that the medical sector is keeping a keen eye on?
Okay. Yeah, thank you very much. Before I quickly comment on the figure, I think there are two other aspects of the BACPF that are important to mention. They receive smaller part of the funds, but are important. One of them is what we call the NCDC Gateway. That's the Nigerian Center for Disease Control. The Gateway, they do receive a little part of the fund, and that part of the fund enables them to be prepared when there are epidemic outbreaks. Not necessarily big ones, but every day we get outbreaks every now and then. So the fund goes to the state, and the minute an outbreak is reported, they are able to immediately respond within the first 24, 48 hours, while the big response through routine mechanisms now comes on board. Then the last one is the Emergency Medical Transport Gateway, which is managed through a committee, National Emergency Medical Transport Treatment Committee at the Federal Ministry of Health, where they are now providing ambulance services for emergencies to move people either from the community to the primary care center, from primary care center to secondary care when there are emergencies. And this is also covered at no cost. So that is scaling up slowly. 30 states are onboarded now, but there are various levels of operation, but already they're reporting people using their services in at least in the tens of thousands at this time. So we expect that to also expand as they get more seamless communication out there, and people are able to call for emergencies when required. So that said, regarding the amount of money for vaccination, I can't authoritatively right now say whether it's adequate or not, because that's under the purview of the National Primary Healthcare Development Agency. But what happens that every year, the MPHCDA, under the leadership of the Honorable Coordinating Minister and the Minister of Health, meets with our partners, particularly the WHO, UNICEF, and Gavi, which is the Global Alliance for Vaccine and Immunization, and determine what Nigeria needs to vaccinate its citizens for routine vaccination and also preparedness where there might be outbreaks for the year. And that is what we call the vaccine resource requirements, and that is now tabulated. And then we now have government of Nigeria provide some funding. So usually there is funding from government of Nigeria and their counterpart funding from our partners. So it's the totality of it that is utilized for vaccination of Nigerians. So what the figure you have called is likely the counterpart funding from the government of Nigeria, which we pool together with all the fundings coming from all other sources and used to provide vaccines for Nigerians. Most the partners, particularly the UNICEF, leads in helps us to get global sourcing at competitive rates for most of the routine vaccines we use across the country for vaccination. So but from the historical knowledge, I think the amount sounds quite laudable from the federal government of Nigeria, and we expect that to continuously this continue to improve so that we're actually self-sufficient in vaccinating our children.
Okay. Okay, Reverend Dominic has come on the line. Good morning to you, Reverend Dominic. You got a question for Dr. Ogbe? Reverend Dominic, good morning to you, sir. We seem to have an issue. I left out the adjective so as not to enter anybody's trouble, but we seem to have an issue. Dr.
Hello, good morning.
Reverend, good morning. We've been waiting for you. We've been waiting for you, Reverend. Go ahead. Can you hear us?
Good morning. Good morning to your guest.
Good morning, sir. Go ahead with your question.
Good morning.
Okay, please, I want to ask a question. If I can, I want to ask a guest, what is different between primary health care and tertiary health care? Is general hospital a tertiary health care or primary health care? Why every question is this? If you go to the general hospital today, the kind of service you get, you will know whether it's primary or tertiary. I have one health center in my village.
Okay.
I grew to New Health Center, sir. In the Imo State, if you are going there with your loved one, you have to go with mattress. There's no mattress in this, health center. So which one is different? And what you are saying here, you have said much of what we are doing, but it's not trickling down to where people live. Our people is not living majorly in town. This primary health care is not needed in the village. But the one in my village is needed. Has no bed, has no injection. It's the fact that you will see one nurse or one doctor, which is the youth service officer, who come to do his service. Just sitting down that place because there's no equipment. How does this thing trickle down? What is different from general hospital and primary health care? At my level, I don't know. I think many people do not know.
All right.
Difference between primary and general hospital. Thank you, sir.
Thank you very much, Reverend Dominic. Well, doctors are professionals, and they will use these professional terminologies. Could you sort of unravel that for the difference between primary secondary
and tertiary, yes,
and then tertiary healthcare?
So in Nigeria, we operate 3 levels of care: the primary, the secondary, and tertiary care. The primary care is the most basic care, and this is the one we provide through primary health care centers across the country. And this is more of what the kind of care you get commonly in the rural parts of the country. The secondary care is the one that is provided where places you normally call general hospitals. So they are provided by more specialized persons and usually treat more complicated conditions. Whereas the tertiary care are the ones, just to be clear, the teaching hospitals are tertiary care. So where you hear teaching hospital, where you hear University of Abuja Teaching Hospital, you hear Kano Teaching Hospital, or you hear Specialist Hospital, Orthopedic Specialist Hospital, Eye Specialist, those are tertiary care. Where you hear general hospitals, those are secondary care, and where you hear primary health care centers, those primary care. But of course, the services that are delivered is dependent on whether it's primary, secondary, or tertiary, depends on the actual service delivered and who is delivering it. So at the primary care, what is done there is basic services, things like health education, immunization, antenatal care, delivery of mothers that are not predicted to have complications, right? Treatment of minor conditions, minor illnesses, treatment of fever, malaria, and things like that, and of wounds. Child health care, looking after children, monitoring their growth, looking after their nutrition, and immunizing them and treating them when they have basic things like pneumonia, respiratory tract infections, diarrhea, and things like that, and referring them if they have more complications. So this is what happens at the primary care. The key of primary care is to focus on prevention, to treat common illnesses and refer those that are a bit complicated, and accept them back after they've been treated at the secondary or tertiary level. So he did mention about the center in its location that he says is in a bad shape. I'm really very sorry to hear that, and we do apologize. There are efforts to actually right now revitalize primary healthcare centers across the country through various means. The state governments are doing revitalization. The federal government has put in some money for revitalization, and especially the Basic Care Provision Fund has put in some money since 2023 and 2024 for revitalization across states, all states in the country. And we do have some grant from what the World Bank called the Impact Project that is doing the bulk of the revitalization right now across the country. So as at close of last month, based on the records we have at the national level, at least 2,164 health centers have been revitalized. And if you do go to pac.nphcda.gov. If you Google that, the full link will come out, which is an https://. So not to go to that, just remember pac.nphcda.gov.ng. You would see the revitalized primary health care centers. You can click on it, look for your village and your ward, and you'll see whether you have one going on there or not. There are a couple going on across the country. We hope to do more, but it requires resources, and so that's happening slowly but surely across the country. So we hope to get to yours soon. But
I beg your pardon, Doctor. I beg your pardon, Doctor. Can I just quickly bring in Mazi Okoroafo, who has called in from Arochukwu. Mazi, good morning.
Good morning, sir. When we talk about this primary care, there are three sectors of the medical sector we have. We have the primary health care, we have general hospital, we have teaching hospital. Now, but today, what is happening? This Counterpart point is very, very important for our primary care to make it functional. People leave the primary care to rush to teaching hospital. Why? Because the facilities are not there. Because if this Counterpart point will come up, let the local government, put their health sectors in good shape. Employ nurses by yourself. Employ at least people you can even employ. It will help us because situation whereby at that primary level we have a lot of problems because the facilities are not there, the doctors are not there, the nurses are not. Even the people that even sell for training assistant health facilities they are not there. So what do? There is need for all the members of local government to make their primary care sector to be functional. People will not be running to pharmacy. People will not be running to all these type of medicine. All these herbal people, they will say that one medicine will cure over 50 diseases, 50 illness, 50 infirmities. That is the problem. Please, the authority concerned, government should do very well that these kind of people should do the needful. Set the facilities. Young boys and young girls who are going to do their NYS. Employ them to work at that primary care level. Even big hospitals in our zone, the local government should also accommodate the primary department in their. If state government can make it compulsory, any hospital within that have primary care sector there, at least to help people adapt to people who cannot start running to city hospitals. That will help us because many people are dying because look at a woman who wants to pregnancy.
Okay, Mazi. Thank you, Mazi. Let's get Dr. Ogbe to respond to that. I think he spoke briefly about some aspect of this comment that you make. But Dr. Ogbe, please go ahead if
Yes.
you have anything.
Okay, so quickly, I think I've explained about the difference between primary and tertiary, and Max is absolutely right. Most times the movement upwards to secondary and tertiary facilities because people don't feel quite satisfied with primary healthcare centers. But in more recent times, in the last 2 years particularly, with the intervention of the BACPF, we've had clear testimonies of people saying they have come back to their primary healthcare centers because it's better. Of course, not all primary care centers are better now. We have standards that we expect them to meet, and very few of them are at that standard at this time, primarily because of the difficulty in getting skilled vet attendants, skilled health workers, the doctors, particularly the midwives, who are the most critical manpower we need at that level to be present. We all are aware of the push and the drain that we have in that sector, and the need to employ and more. Now, the management of primary healthcare centers really at this time rests on the states through what we call primary healthcare under one roof. And the local governments, with the ruling of the Supreme Court, have now become more active in trying to ascertain and take up their role in seeing that primary healthcare works under their various local governments. So we're really looking forward enthusiastically to improvement. But in the interim, I think the federal government, through various fundings, have recently, in the last year, recruited over 1,100 midwives and posted them to places where they are needed. The BACPF also recruits midwives, and about 2,000 plus, 500 plus midwives are under the BACPF that I recruit, not as permanent staff, but as shop guards across the country in various states. So that fund comes in regularly to engage them where they are valuable.
Has this, Doctor, I beg your pardon, has this impacted the maternal mortality rate that I know people in your profession have been struggling to bring down? What's the situation there?
Yeah, it has impacted positively, because at the JAR on Wednesday, the administrative records, that means the records we get through our National Health Information System, indicated that at least 92% of women who came to the health centers were attended to by skilled vet attendants. That means they attended to people that were qualified. And we've seen some modest but real progress in terms of reduction in maternal deaths. But in terms of the rates, these are done through through surveys that occur every 3 to 5 years to actually let us know what the rates are, because there's a critical number of people in most survey across the country to be able to determine what the rates. But we're seeing improvements from the administrative data.
I think that's a fine place to leave it, Doctor. I know there's a whole lot more to talk about, but we've run out of time. Yes. This has been so informative, and I want to thank you very much for coming and sort of helping us place ourselves really in the humongous work that is going on that we call the focus on primary health development in Nigeria. I want to thank you very much, Dr. Oritseweyimi.
Thank you so much for the opportunity. It's very much appreciated.
Indeed.
Thank you so much for the opportunity. Yes, please.
Thank you very much. Okay, so we're going to leave it there. Do please join us for our next program, which will be on Monday for a fresh edition. I am Yori Folani. Bye-bye for now.